This week on Real Talk with Denver7 and CPR News, it's dubbed the One Big Beautiful Bill.
While there's promise for good from the new law, we are hearing about the negative impacts this could have on Colorado communities.
It's a direct attack on our communities, our neighbors, our families.
From food help availability and healthcare accessibility to how much is taxed on tips.
How many people are turning a blind eye to the plight of, in favor of we're offering a benefit for one class of worker?
We dig into the ways this can impact you and your neighbors, plus how to navigate the changes.
Welcome to Real Talk with Denver7 and CPR News. I'm Colorado Public Radio's Nathan Fernando Frescas.
And I'm Denver7's Micah Smith. Each week in a partnership between Denver7 and CPR, we have a real talk about issues impacting underrepresented people across Colorado and amplifying voices you may not always hear.
This week, we're focusing on how individuals, families, and even businesses are impacted by federal changes signed into law by President Trump.
According to the White House, the legislation points to benefits for middle and working class Americans. Some of those include the, quote, largest tax cut in history, which will reportedly benefit those making less than $50,000 per year. There's also the promise for bigger paychecks, no tax on tips, overtime, and Social Security, and also slashes $1.5 trillion in federal spending.
But among the cuts are changes to pivotal resources that thousands of Coloradans rely on to keep the lights on, food on the table, health in check, and a roof over their head. So many of those organizations are here in our community and are now helping people understand how this will impact them while also navigating the changes too.
So today you will hear from nonprofits and a small business owner going through this experience along with the community, starting with one hunger relief organization.
So joining us now is Chief Impact Officer Monica Bulig from Food Bank of the Rockies. Monica, thank you so much for being here today.
Thank you for having us.
So what do these changes mean for those receiving SNAP benefits?
Yeah, so SNAP, known as the Supplemental Nutrition Assistance Program, is a program where people who are struggling to make ends meet from paycheck to paycheck, having a hard time putting food on their table, receive some additional income that they can use to purchase food at local markets. We are seeing the highest rates of food insecurity that we've seen in over 10 years. 1 in 8 Coloradans are experiencing hunger. So what this means is that as SNAP benefits are reduced, more people will be experiencing hunger. And similarly, there won't be the revenue going into the local markets or to the local farmers and ranchers supplying those markets. So it's a twofold impact on economics and food access.
Yeah.
I know Denver7 and CPR have received tons of emails and viewer phone calls just concerned about how this might impact them. What concerns are you hearing from families who are concerned about their SNAP benefits?
Yeah, families are very uncertain about what this means to them. However, they know that SNAP is their safety net. We served a neighbor recently on the Western Slope who's 65 years old, worked her entire life, and uses SNAP to purchase her groceries. She said she's seeing the highest cost of proteins and fruits that she's ever seen, and she doesn't know what will happen if she loses her SNAP benefits, if she'll be able to stay housed, and how she will make ends meet.
And so how do you answer that question when you may not know yourself what's coming down the road?
Yeah, we tell people that we're here for them. We provide outreach and enrollment assistance to people who are experiencing hunger, and we will stay true to our mission and focus on supporting them and answering their questions. And that they can come to Hunger Relief Partners of Food Bank of the Rockies to get assistance, because we are the safety net that covers the safety net that is starting to disintegrate.
A literal lifeline. There are other changes that impact more than SNAP, including Food Bank of the Rockies directly. Can you talk to us about that?
Yeah, absolutely. In addition to the increasing need, we recently saw cuts to some of the foods that were provided to us by the United States Department of Agriculture, or the USDA. And as a result of those cuts, which purchased foods from out the country, we have seen a reduction in 14,000 meals per day that we are able to provide to neighbors. And to put that in context, we provide 185,000 meals per day.
Wow.
Yeah.
And so with that, it seems to me it's not just impacting the person who wants the food, it's the people growing the food, it's you providing the food. It is like this net that is, well, it's literally the safety net, Micah, that is going away.
Yes, the safety net is disintegrating. And we will stay true to our mission, but it is going to take more. Our mission is to ignite the power of community, to nourish people experiencing hunger. And it is going to take more community than ever before, because without the supplement of SNAP, for every one meal that we provide, SNAP provides 9.
Wow.
So it is going to take more community than ever before to wrap around our neighbors who are experiencing hunger. And they are literally our neighbors. They are our colleagues, they are our friends, they are family members, they are people aging in communities, and it's going to take all of us to support them.
So you are calling on community to really join together and stand in the gap. Anything else that you're doing to really try to stand in that gap and make sure these families, these people don't go hungry?
Yes, we are making sure that we're covering all of the areas within our community. Rural communities are going to be hit hard. First, because they're the farmers and the ranchers. Second, because their markets will receive less. And thirdly, because it's just harder to get from places to places. So we have expanded our services so that we have more food available to people in rural communities. So we are expanding where there are gaps, and that's important. And then we are doing what we can to fill the widening gap between food and hunger, and we will continue to do so.
Such important work. Monica Buleg, Chief Impact Officer of Food Bank of the Rockies, thank you so much for joining us for this Real Talk.
Thank you for having this conversation.
And coming up, this funding bill also brings sweeping healthcare changes.
From new Medicaid work requirements to defunding Planned Parenthood, we break down what it means for care access across Colorado. This is Real Talk with Denver7 and CPR News.
The following segment was recorded before a federal judge ruled Planned Parenthood clinics nationwide must continue to be reimbursed for Medicaid funding.
Welcome back to Real Talk with Denver7 and CPR News. I'm Colorado Public Radio's Nathan Fernando Frescas.
And I'm Denver7's Micah Smith. President Trump's big, beautiful bill is having a huge impact on health care. NPR recently found the deepest cuts to government health care spending will come from a proposed work requirement for Medicaid.
In the 40 states that expand Medicaid under the Affordable Care Act, Medicaid enrollees will have to prove they're working, volunteering, or attending school for at least 80 hours a month, or prove they qualify for exemption. This requirement takes effect in January 2027, but does not apply to 10 GOP-led states who chose not to expand Medicaid.
Another big impact of the tax bill on Medicaid, it ends Medicaid payments to abortion care providers like Planned Parenthood, who offer family planning services and received more than $800,000 from Medicaid in 2023.
According to ABC News, Planned Parenthood is not specifically mentioned in the statute, but Planned Parenthood leaders say it impacts 600 centers in 48 states.
Planned Parenthood reports 2/3 of their health centers are in rural and medically underserved areas. Joining us now is President and CEO of Planned Parenthood of the Rocky Mountains, Adrienne Manzanares. Adrienne, thanks so much for joining us for this Real Talk.
You bet, of course.
What has been the immediate impact of this tax bill on Planned Parenthood in Colorado, Wyoming, and New Mexico, the states that you serve?
One of the really terrible results of this bill for Planned Parenthoods was that the cut went into effect immediately. So when the president signed it into law on July 4th, we were calling patients that were scheduled to come in that Saturday on July 5th. That's one of the most devastating impacts. I mean, imagine you're going to your doctor, you're getting your health care, and then you're told that you're no longer allowed to use your insurance and that we can't see you even if you choose to pay out of pocket.
How were those conversations? You must have heard from providers that it was just heartbreaking.
It was terrible. So again, imagine where you all were on July 4th. Many of us were on vacation. We were at barbecues. We all rallied together to be able to call patients, many of them sobbing, crying, what do I do next? There were patients that we were unable to connect with over the weekend, so when they came in for their appointment, they were told when they were checking in that we could not see them. We had one patient who had tested positive for a sexually transmitted infection. He was on his second round of antibiotics to clear it up, and he was told he could not come in and that we weren't allowed to treat him. It's been devastating.
I'm hearing from a lot of Colorado voters, liberal Colorado voters, who think the state is insulated. This really won't impact our state. Colorado voters actually voted to allow Medicaid to cover abortion, and this would take effect in January. So does the president's tax law still have an impact in Colorado?
It does. It's terrible. Despite the fact that so many people in Colorado understand that abortion care is health care, so many people in Colorado support Planned Parenthood, this terrible bill takes away federal dollars from all forms of family planning services. So there's already a law that abortion care cannot be covered under federal dollars. It's been the Hyde Amendment for many years. We've followed that law. It's already been illegal to take federal dollars for abortion care. What this bill does is incredibly cruel. It's a complete attack on our patients using Medicaid. No more birth control, pregnancy tests, STI testing and treatment, cervical cancer or breast cancer screening, all of that is now forbidden under the Medicaid system.
I'm thinking there are possibly options in bigger cities, Denver, Grand Junction. What about rural areas where this might be the only option?
Yeah, your previous guest, Monica, brought this up beautifully. Our rural communities in Colorado are the heart of the entire state. There are so many incredible industries, very important communities in our rural areas. Sadly, though, there aren't a lot of healthcare providers. So for our patients living in rural communities, we are the only provider. They come to Planned Parenthood for, again, reproductive and sexual health care. Our patients are very healthy. They need to come in and out once a year. We love seeing them. It's those folks that are going to have the hardest time finding another provider. And again, they need to find a provider that accepts Medicaid. So that makes the distance even longer for them to travel for care.
Well, Adrienne, what would you say to those who say the government should not be funding abortion, whether it's state or federal, and that's what's providing Medicaid patients to Planned Parenthood? That's what it does.
Yeah, I hear this joke response a lot, and it's even more insulting because there's already a law that federal funds cannot fund abortion care. That's there. So the out-of-touch Republicans in Congress who use that as an excuse are lying. They are trying to defy Medicaid and try to deny Medicaid from patients who need it the most. It's a direct attack on our communities, our neighbors, our families. This has nothing to do with abortion care. It has everything to do with selfish, out-of-touch Republicans in Congress with these tax cuts on the back of our own communities.
With people who rely on Planned Parenthood and they came in and you're like, we can no longer help you. What are you telling them? Is there that support net we heard about in our last segment? Is there a support net for the support net?
Yeah, Nathan, this is the hardest. This has been the very challenging couple of weeks, as you might imagine. Our patients want to come see us. So when we say to them, it's no longer legal, there's a federal law in place, we can't take your insurance, we can't see you, they're canceling their Medicaid. So they think that they can then come into our health centers. They're doing anything they can to try to come back to Planned Parenthood. And again, I'll just say, we are a deeply popular healthcare provider. We provide non-judgmental, comprehensive care in an expert way. 1 out of 4 people come to a Planned Parenthood. They want to come see us. So when they're told that we have to follow the law, there are tears, there's anger, a lot of confusion. And I will say I'm very grateful for the providers in our communities who are stepping up and who are able to see our patients. So when we can do that warm handoff, that is fabulous. But to the point we made earlier around rural communities, there may not be another provider. We are the safety net that y'all were talking about earlier.
Adrienne, what's missing from the national and local conversation surrounding the tax bill and Medicaid?
Well, I'll say this show's doing a really nice job of shining a light on what I have found to be missing in these conversations. One is that I think that the national conversation has been really spinning around politics. When we're looking at the news or we're hearing what's going on in podcasts or what's going around in even social media, it's still this bickering and fighting between previous presidencies and the current president, or we're looking at ideological discussions or religious arguments. That's not what's at the heart. What's at the heart of this discussion are our families, their people. It's the generations of folks, and again, people living in rural communities, low-income people, our Black, Indigenous, people of color, and the communities that need Planned Parenthood the most. It's those generations that are going to be most impacted, and I want our politicians to have conversations with those constituents.
President and CEO of Planned Parenthood of the Rocky Mountains, Adrienne Manzanares, thank you so much for joining us for this Real Talk.
Thank you, Micah, and thank you, Nathan, so much for having me.
Coming up, no tax on tips was a big campaign promise for President Trump, but what does it actually mean for millions of tipped workers?
We talked to a Denver restaurant owner about how this new tax law is playing out in the real world for workers, wages, and small businesses.
This is Real Talk with Denver7 and CPR News. Welcome back to Real Talk with Denver7 and CPR News. I'm Denver7's Micah Smith.
And I'm Colorado Public Radio's Nathan Fernando Frescas.
One of the big promises President Trump made on the campaign trail was this.
It's called no tax on tips. No tax on tips. No tax on tips.
And the president's fiscal bill, which he signed into law, included that promise, kind of.
Right. Tipped workers will now be able to deduct up to $25,000 from their taxable income, but it's not a tax exemption, it's a deduction.
That deduction won't last forever, but through 2028. And there are quite a few caveats created in the bill, like recording those tips on a W-2 or other IRS form, and it only applies to certain jobs that the Treasury Department will determine.
Forbes magazine says more than 4 million Americans work in tipped occupations, but many earn too little to owe federal income tax at all. And with standard deductions and other credits, others might already have zero income tax liability.
So to better understand how this all will impact workers and businesses, we are joined by Dolores Tronco. She's the owner of the Greenwich on Larimer Street in Denver. Dolores, thank you so much for being here for this Real Talk.
Thank you for having me.
Well, first things first, tell us a bit more about your restaurant.
So the Greenwich is a full-service Italian restaurant located in the Rhino neighborhood, or River North for those that don't know the shorthand. We've been open about 4 years in September.
How many employees do you have and how many receive tips?
We have 34 employees, most of whom are full-time, and about 1/3 of those employees receive tips.
And what do they know about this current change in the law, and what do they think about no tax on tips overall?
Sure. I mean, from a surface level, who doesn't love the idea of not paying tax on part of your wages, right? So I think at a very surface level, they're fairly excited. Most of them, truthfully, don't really understand how it's going to work. They're not necessarily familiar with the fact that it's a year-end tax deduction versus that they'll be seeing an immediate return or an immediate increase on their paychecks week to week.
Yeah.
So we've been trying to educate our workforce just a little bit so that they know what to expect moving forward.
All right, so let's take a closer look at what this bill does and what it says. So Forbes magazine reports a bartender earning $35,000 in wages and $15,000 that is in tips might save $2,000 or more on their tax bill each year if they properly file their taxes and record their tips. But they add that the bartender is, quote, not too poor to owe tax, not too rich to phase out, and perfectly tax compliant. That's a lot to absorb. But what are your initial thoughts on this?
No, I think this speaks to the bartender in this scenario as sort of the typical middle class taxpayer. This is not a person who's making so little that they're exempt from taxes, and they're also not making so much that they're sort of privy to those phase outs that happen in the higher income brackets. And so, you know, some folks would say this is the backbone of the tax system. There are also people that we don't often talk about. We talk about provisions for the very, very wealthy, and we talk about provisions for the very, very poor. So in that way, to me, that's what that particular quote from Forbes is talking about. And I think one could argue that there are certainly a share of bartenders and servers that's a pretty relevant example or way to think about them.
Yeah, but let's flip it around to someone who's not that, you know, and how are they feeling about this, and how will you work with them within this new system where they think they may have this coming, but then they actually may not? Does that make sense?
To an extent,
Sure,
I guess.
yeah.
You know, I think we are bound to be compliant with the law,
Right.
right?
Right.
Regardless. And so, we have spoken with our accountants, and we've always included all tips on paychecks. And so, they'll have their W-2s at the end of the year, and then from there, they can go ahead and file that as a deduction. One of the things that's really come to mind for me as a restaurant owner is the way that this is failing our back of house staff.
Oh, explain that. What do you mean?
So, in the restaurant industry, as I mentioned, 1/3 of my staff does receive tips, and then there's 2/3 that don't. And they work very hard, and in fact, they make less money than the servers and bartenders on an hourly basis. So at the Greenwich, our servers and bartenders are making an average of $37 to $48 an hour. And that includes their base wage and their tips. And so, I think about my back of house team who's making $22 or $23, and we can't afford to pay more than that. And so I think about them. Why are they not part of this? Why I think about all the folks that are working 2 jobs trying to survive because of those lower wages. And I think something that struck me is that while I think all restaurateurs, sure, will always champion our workers and things that'll benefit them, but I can't help but think from a macroeconomic perspective, how many people are we turning a blind eye to the plight of in favor of we're offering a benefit for one class of worker?
As a business owner, are there incentives for restaurant owners, to your knowledge, to now lean more into tippable compensation over base wages?
So I think you can look at that from both a qualitative and a quantitative analysis. So quantitatively, there really isn't. We will continue to pay 100% of the federal taxes that we've always paid on behalf of our employees. While they may take a tax deduction for those tips, we don't. That is not something we benefit from at all. So quantitatively, our books will look the same. Qualitatively, one could argue that perhaps by switching to a more tipped model for more employees, that maybe it would attract more talent. That's certainly one way to think about it. But I think the analysis is a little more complicated. In Denver specifically, and in Colorado, we have a very, very high tipped minimum wage. In fact, Denver has the highest tipped minimum wage in the country at $15.79, and that increases every January 1st by the amount of the consumer price index. That's the inflationary index, as you know. And so for us, for many operators in Denver, we've all adopted a service charge model,
Right.
and it's what allows us to keep our doors open. With this provision, those dollars, service charge dollars, are not tax deductible. Tips are, right? So now a restaurant might have to choose between, do I switch to a fully tipped model and imperil the health of my business altogether? What if I have to close and I have now 34 people don't have jobs, right? Or do I switch to a more tipped model to try to allow more employees to maybe reap the benefits of that tax deduction? So as you can tell, it's pretty complicated.
Such an important perspective, Dolores Tronco, owner of the Greenwich on Larimer Street. Thank you so much for being here for this Real Talk.
Thanks for having me.
And that is this week's episode of Real Talk with Denver7 and CPR News. Every week, we'll be having a real talk on issues that impact Coloradans who are often overlooked.
You can find all of our shows on denver7.com/realtalk or at cpr.org/realtalk. Have a great day.